Hello, today, we will walk you through a tutorial on how you as a doctor can use ChatGPT or generative AI. We cover 10 use cases, and for each, we provide examples and prompts that you can adopt in your everyday practice. Please watch till the end, as we will share with you where you can use generative AI for free. Patient education and communication. You can use ChatGPT in the following examples. 1. Explain medical conditions in layman's terms. For example, use the prompt, "Please explain hypertension in simple language for my patient." 2. Clarify treatment options and their side effects. For example, use the prompt, "What are the common side effects of chemotherapy for breast cancer?" 3. Provide dietary recommendations for specific health conditions. You can try this prompt. Could you suggest a diet plan for a patient with type 2 diabetes? 4. Interpret medical jargon from reports or test results. Example prompt, "Can you help me decipher this MRI report for my patient?" 5. Offer guidance on managing chronic illnesses. Example, "What are some lifestyle changes my patient can make to better manage their asthma?" Continuing medical education CME, and research. Here are some example use cases. 1. Summarize recent medical literature or clinical studies prompt with ChatGPT. Can you provide a summary of the latest research on Alzheimer's disease? 2. Assist in literature reviews for academic projects. Prompt with ChatGPT. Help me find recent studies on the efficacy of statins in reducing cardiovascular risk. 3. Generate ideas for research topics or study designs. Example, ChatGPT, "I'm looking for inspiration for a research project on pediatric obesity. Can you suggest some ideas?" 4. Explain complex medical concepts for educational purposes. ChatGPT, "Can you simplify the pathophysiology of heart failure for a presentation I'm preparing?" 5. Provide evidence-based answers to medical queries. Example, ChatGPT, "What does the current literature say about the use of probiotics in treating irritable bowel syndrome?" 2. Generate referral letters or medical documentation. ChatGPT, "Please draft a referral letter to an oncologist for a patient with suspected lymphoma." 3. Provide discharge instructions for patients leaving the hospital. ChatGPT, "What key points should be included in discharge instructions for a patient recovering from a myocardial infarction?" 4. Facilitate telemedicine consultations with patients. ChatGPT, "Help me prepare for a telemedicine appointment with a patient who has questions about their recent surgery." 5. Offer guidance on transitioning patients to palliative care. ChatGPT, "What are some important considerations when transitioning a patient to palliative care?" Medical decision support. Here are some use case examples. 1. Assist in differential diagnosis for complex cases. ChatGPT, "Based on these symptoms, what are the possible differential diagnoses for my patient?" 2. Provide evidence-based treatment recommendations. ChatGPT, "What is the recommended first-line treatment for a patient with newly diagnosed rheumatoid arthritis?" 3. Calculate drug dosages or infusion rates. ChatGPT, "Can you calculate the appropriate dosage of heparin for deep vein thrombosis prophylaxis in a hospitalized patient?" 4. Offer guidance on antibiotic selection and stewardship. ChatGPT, "Which antibiotic would be most appropriate for treating a patient with community-acquired pneumonia?" 5. Interpret guidelines or protocols for clinical decision-making. ChatGPT, "Help me understand the latest guidelines for managing hypertension in elderly patients." Mental health support. Here are some use case examples. 1. Provide psychoeducation on mental health conditions. ChatGPT, "Could you explain the symptoms of generalized anxiety disorder to a patient?" 2. Offer coping strategies for patients dealing with stress or trauma. ChatGPT, "What are some effective coping mechanisms for patients experiencing post-traumatic stress disorder?" 3. Assist in screening for mental health disorders. ChatGPT, help me create a questionnaire to screen for depression in my patients during routine appointments. 4. Suggest resources for mental health support and therapy. ChatGPT, what online platforms or apps do you recommend for patients seeking virtual therapy sessions? 5. Provide guidance on managing medication adherence in psychiatric patients. ChatGPT, what strategies can I recommend to help a patient with schizophrenia adhere to their medication regimen? Medical student and resident training. Use case examples. 1. Answer medical questions and clarify concepts for learners. ChatGPT, can you explain the mechanism of action of ACE inhibitors to a medical student? 2. Provide tips for studying and preparing for medical exams. ChatGPT, what are some effective study techniques for preparing for the USMLE Step 1 exam? 3. Generate case studies for teaching purposes. ChatGPT, help me create a case study on a patient presenting with acute appendicitis for morning rounds. 4. Offer advice on career development and specialty selection. ChatGPT, what factors should medical students consider when choosing a specialty? 5. Assist in writing case reports or research papers. ChatGPT, help me draft the introduction section of a case report on a rare neurological disorder. Medical practice management. Use case examples. 1. Optimize clinic workflow and scheduling. ChatGPT, suggest ways to streamline patient appointments and reduce wait times in my clinic. 2. Provide guidance on coding and billing procedures. ChatGPT, can you clarify the coding requirements for billing a telemedicine consultation with Medicare? 3. Offer strategies for patient retention and satisfaction. ChatGPT, what are some effective ways to improve patient experience in my practice? 4. Assist in inventory management for medical supplies. ChatGPT, help me create an inventory list for restocking medical supplies in our clinic. 5. Generate templates for standard documentation and forms. ChatGPT, could you create a template for patient consent forms for surgical procedures? Healthcare policy and advocacy. Use case examples. 1. Provide insights on healthcare policy issues and legislation. ChatGPT, what are the potential impacts of the latest healthcare reform proposal on primary care physicians? 2. Offer guidance on advocating for patient rights and access to care. ChatGPT, how can I advocate for improved mental health services in my community? 3. Assist in preparing presentations or white papers on healthcare topics. ChatGPT, help me draft a presentation on the importance of preventive care for a conference. 4. Provide information on public health initiatives and campaigns. ChatGPT, what are some ongoing public health campaigns aimed at reducing obesity rates? 5. Analyze healthcare data to identify trends and disparities. ChatGPT, can you help me interpret these data on vaccination rates among different demographic groups? Physician wellness and burnout prevention. Use case examples. 1. Offer stress management techniques for healthcare professionals. ChatGPT, what are some effective ways for physicians to manage stress and prevent burnout? 2. Provide resources for self-care and work-life balance. ChatGPT, could you recommend some mindfulness exercises for busy healthcare professionals? 3. Assist in setting boundaries with patients and colleagues. ChatGPT, how can I politely decline additional work requests to prevent overcommitting myself? 4. Suggest strategies for fostering a supportive work environment. ChatGPT, what initiatives can I implement to promote camaraderie and teamwork among my medical team? 5. Offer guidance on seeking professional help for mental health issues. ChatGPT, what are the signs that I should seek professional help for my mental health, and how can I find a suitable therapist? Telemedicine and remote patient care. Use case examples. 1. Provide guidance on conducting virtual physical examinations. ChatGPT, what are some effective techniques for assessing a patient's respiratory status during a telemedicine appointment? 2. Assist in remote monitoring of chronic conditions. ChatGPT, how can I remotely monitor a patient's blood glucose levels and provide feedback for diabetes management? 3. Offer tips for maintaining patient engagement during telehealth visits. ChatGPT, what strategies can I use to keep patients actively involved and engaged during telemedicine consultations? 4. Provide guidance on ethical considerations in telemedicine practice. ChatGPT, what ethical issues should I consider when providing telemedicine services, particularly regarding patient privacy and informed consent? 5. Suggest tools and technologies for telemedicine implementation. ChatGPT, what are some user-friendly telehealth platforms I can use for virtual consultations with my patients? As promised, here are some free generative AI tools that I recommend you use. These tools empower users without requiring a subscription fee. Let's explore these tools and their unique features. 1. Microsoft Copilot, formerly known as Bing Chat. Microsoft Bing Chat, now known as Copilot, is powered by OpenAI's ChatGPT. It offers a seamless experience for users who want to harness the capabilities of ChatGPT without any subscription costs. As Copilot utilizes ChatGPT-4, it provides advanced language generation capabilities. Copilot can fetch current information from the web, ensuring that the generated text remains up to date. Copilot also provides references to support the information it generates. 2. Perplexity. Perplexity, based on ChatGPT 3.5, is another free generative AI tool. It strikes a balance between speed and accuracy. Perplexity generates responses quickly. Like Copilot, Perplexity leverages internet search to provide current information. Users receive references alongside the generated content. 3. ChatGPT by OpenAI. ChatGPT, offered in its free version, is a versatile generative AI tool. However, it's essential to note that it operates independently of the internet, so the answers it provides may not be current. ChatGPT generates responses without relying on real-time internet searches. It's suitable for various tasks, from creative writing to answering questions. For free access to ChatGPT-4, consider using Copilot from Microsoft. 4. Gemini by Google. The migration from Bard to Gemini brings forth an updated generative AI tool. Although still in development, Gemini shows promise. Gemini doesn't require a subscription fee. At present, Gemini relies on its training database rather than real-time internet data. 5. Claude by Anthropic. Claude, a free generative AI tool, caters to basic use cases. However, it lacks real-time search capabilities. Claude provides fundamental language generation. Answers are derived from its existing training data. Keep in mind that Claude doesn't fetch current information. When using generative AI tools, it's essential to be aware of potential pitfalls and take precautions. Here are some considerations. 1. Quality and accuracy. Generative AI models can produce impressive content, but they may also generate inaccurate or nonsensical information. Always verify the output, especially if it's critical or factual. Be cautious when relying on generative responses for professional or important tasks. Human review and validation remain crucial. 2. Bias and fairness. AI models learn from existing data, which can introduce biases. These biases may manifest in the generated content, reinforcing stereotypes or discriminatory views. Users should critically evaluate the output and consider potential biases. Avoid perpetuating harmful stereotypes. 3. Privacy and confidentiality. Avoid sharing sensitive or personal information with generative models. Even if the content seems fictional, it's essential to protect privacy. Generative AI tools may inadvertently generate text that reveals confidential details. Exercise discretion. 4. Context and intent. Generative models lack true understanding of context and intent. They generate responses based on patterns in the training data. Users should provide clear context and specific instructions to improve the relevance and accuracy of the generated content. 5. Overly and CE on automation. While convenient, relying solely on AI-generated content can lead to complacency. Balance automation with human judgment. Use generative tools as aids, not replacements for critical thinking and creativity. 6. Ethical use. Avoid using generative AI for harmful purposes, such as spreading misinformation, creating fake news, or engaging in malicious activities. Responsible use ensures that AI benefits society without causing harm. Remember that generative AI tools are powerful, but they require thoughtful handling. By understanding their limitations and being mindful of potential pitfalls, users can maximize their benefits while minimizing risks. Thanks for watching. If you would like to see more content like this, please don't forget to like and subscribe to our channel. Check out my blog post with the text for the prompts, and feel free to copy-paste and modify for your needs. The link is in the description of this YouTube video.